Hi there and welcome. My name is Jillian Barav. I'm a registered herbalist and licensed nutritionist. And today I want to talk about Vitex and PCOS. There's a lot of confusing information out there and I want to try to make some sense of it. PCOS stands for polycystic ovarian syndrome, and it is a hormonal imbalance. So the main question I'm trying to answer is, should I be using Vitex with my PCOS clients or not? And to give you a bit of background, I have PCOS personally, and I work with people who have it. And I've always thought that Vitex is a great herb for PCOS. But recently I started to hear from other experts on PCOS that they don't use Vitex in most cases of PCOS. So I wanted to try to get to the bottom of it and understand why. What we are going to do is look at what Vitex is doing in the body. We're going to talk about some considerations around dosage, and then talk about whether using Vitex in PCOS makes sense. So the herb we're talking about is Vitex, and the common name is chase tree berry, and the botanical name is Vitex agnus castus, and the part of the plant that is used medicinally is the berry. So what is Vitex doing in the body? What you will see online and in many texts is that Vitex should be avoided in PCOS because it raises LH, which stands for luteinizing hormone. This is reasonable. If Vitex raises LH, you would not necessarily want to use it in PCOS because people with PCOS may have chronically elevated levels of LH already, and that's part of what's contributing to the hormonal imbalance. These are a couple of websites where I had seen this information listed. So let's go over luteinizing hormone. Luteinizing hormone is secreted from the pituitary gland. If we look at this diagram on the left, it is secreted after the hypothalamus has been triggered with gonadotropin releasing hormone that sends a signal to the pituitary to release LH. And this usually happens, or it's supposed to happen, at the mid-cycle of the menstrual cycle, around day 14 of a standard 28-day menstrual cycle. And there's a big surge of LH, and that causes ovulation, where the ovary will release a fully mature egg. If we look at the diagram on the right, what's left behind on the ovary is the corpus luteum. And the corpus luteum has an important job. It secretes progesterone during the second phase, or the luteal phase of the menstrual cycle. And progesterone sends a negative feedback to the pituitary to stop releasing LH, as well as FSH, which is follicle stimulating hormone. So where did the understanding that Vitex raises LH come from? I looked around, I looked at the studies, and I got even more confused because what I was seeing in studies is that Vitex lowers LH. So then I started asking around to people who I had heard about this from, that Vitex raises LH. One of the people that I reached out to is a naturopathic doctor named Laura Bryden, and I was thrilled to hear back from her. She even provided me with the exact place that she had learned about this. And it was a book that I'm familiar with, Principles and Practice of Phytotherapy by Simon Mills and Carrie Bone. Excuse me. And in this book, it referenced a 1961 study that was done on guinea pigs. They fed guinea pigs Vitex. They saw changes in the guinea pigs, and then they thought that those changes were due to an elevation in LH and a reduction in FSH. So luckily, I also have the second edition of this book, which was published in 2013. And what I found in the second edition was really interesting. There was a correction to the first edition. In response to in relation to this 1961 study, a direct quote is, "These findings were interpreted to be the result of increased LH and decreased FSH, but these pituitary hormones were never measured." Bone and Mills go on to say that the understanding that Vitex raises LH is no longer consistent with our current understanding of what Vitex does. But what had happened is that from this 1961 study, which was done in Germany, it was promoted as fact, and it made its way into all the literature. And the German Vitex product manufacturers included it with their products. And so it has become an insidious fact that LH is raised by Vitex, even though we now know different. Okay, so if Vitex isn't raising LH, what is it doing? We now know that Vitex has dopaminergic activity. That means that it acts on dopamine. Dopamine is secreted from the hypothalamus, and when it is stimulated, it will inhibit prolactin release from the pituitary. I want to also mention the effect that this has on progesterone. So it will have an indirect increase on progesterone. And this is in cases where there is high prolactin. When prolactin is elevated, it can get in the way of the corpus luteum development. And if you'll remember what we just talked about, the corpus luteum is responsible for secreting progesterone in the second half or the luteal phase of the menstrual cycle. So by bringing down elevated prolactin, it is actually supporting the corpus luteum development and causing an indirect increase in progesterone. Another interesting thing that I found was that the stimulation of dopamine release actually can have a direct lowering effect on LH. And I also want to mention that Vitex is not just acting on dopamine. It is known that there is opioid receptor activity as well as estrogen receptor activity. So in summary of what Vitex is doing in the body, you'll see many references that Vitex is raising LH and therefore contraindicated with polycystic ovarian syndrome. This is now understood to not be based on the current evidence. What is understood is that Vitex is dopaminergic, and this can actually directly lower LH. So now I want to move into dosage, but I first want to have a short talk about some historical information. So I mentioned at the beginning that the official common name for Vitex is chaste treeberry. Like many herbs, it has many common names, and one of its historical common names was monk's pepper. So why do you think it had these names, or even still has this name, chaste treeberry? I mean, it is now widely used for fertility. Why would it be called chaste treeberry? And why would monks have wanted to ingest something, perhaps? So those names imply that there was a suppression of sexual excitability or desire in some way. Why would chaste treeberry suppress sexual excitability? What hormone is known to suppress sexual desire? Prolactin. Okay, but everything that we were just talking about was about how Vitex stimulates dopamine, thereby inhibiting prolactin. And if we look at this diagram, there are lots of things that can influence whether dopamine is stimulated or whether dopamine is inhibited. If it is stimulated, prolactin goes down. If it is inhibited, or in other words, if dopamine goes down, prolactin will go up. So what does this have to do with Vitex and monks? So the effects of Vitex may be dose dependent, meaning that smaller doses and higher doses may have different activities. And in fact, some studies have shown that it has different effects on prolactin production depending on the dose. Here is a study where a Vitex extract was tested in different doses. The low dose was 120 milligrams and the high dose was 480 milligrams, and there was a placebo. It was shown that the low dose increased prolactin, whereas the high dose had a slight decrease in prolactin. I want to point out this other study. This one is not about different doses having different effects, but it is based on an even lower dose of Vitex. 20 milligrams of Vitex extract daily for 3 months resulted in a reduction in prolactin release. Now, this study was done on people who had high prolactin levels, which was interfering with their hormonal balance and their menstrual cycles. So the other study had been done on healthy males who don't have menstrual cycles. So I don't have any conclusions to make based on these two studies, but I did want to point them out because the dosage is important in the grand scheme of things. So it seems somewhat confusing. What is low dose and what is high dose? And I would say it is confusing. First of all, there's two different ways that Vitex is being both studied and used. So a lot of the studies are using these standardized extracts in very low doses. So a low dose might be somewhere between 4 and 40 milligrams. Yes, even doses as low as 4 milligrams have been used. In the study that we just looked at on men, their low dose was 120 milligrams. Now, some herbalists, especially those out of Germany, are using low doses of 20 to 40 milligrams per day of a standardized extract, but many herbalists are using crude herb or tincture equivalent, where a low dose would be somewhere between 200 and 500 milligrams. Now, a high dose of the extract, when we looked at the male study, was 480 milligrams, but it even could be that a high dose is lower than that, or lower than the low dose of 120 milligrams, because again, herbalists out of Germany are using 20 to 40 milligram doses, where 40 milligrams may be considered the high dose. In terms of crude herb or tincture equivalent, doses from 1,000 all the way up to 2,500 milligrams are used. So should we use Vitex in PCOS, and at what dosage? I think it's pretty clear that in cases of PCOS where there is elevated prolactin, that Vitex is indicated. We get some information about dosage from Bone and Mills from that second edition of Principles and Practice of Phytotherapy, and you can see this yourself on page 490 if you have the book. 200 to 1,000 milligrams a day is recommended when there is moderate prolactin or androgen excess, and 1,000 to 2,500 milligrams per day in cases of higher prolactin or androgen excess. So what this is telling me is clinically higher doses will have more of a prolactin lowering effect. Now, what if you don't know anything about prolactin levels? That's okay. An average dose, according to a 1997 survey, came out to be 440 milligrams per day. Now, this wasn't particular to PCOS. This was a survey of herbalists using Vitex for a whole range of female hormonal complaints, but the average was 440 milligrams per day. And this is how I was taught to use Vitex. It was taught to me more like 500 milligrams per day or something around that. 500 milligrams is equivalent to half a gram. And if you look at Vitex products where it's just encapsulated Vitex berry powder, it's very easy to find a product that approximates that dose. Also, it can be blended with other herbs into tincture formulations easily at that dose. With this other information about low dose and high dose, there may be cases where trying out a much lower dose or a much higher dose may make a therapeutic difference. Now, the other thing I would look at when thinking about whether to use Vitex in PCOS is whether the herb fits other aspects of the case. So traditionally, Vitex has been used for irregular and skipped menstrual cycles, meaning when the menstrual cycles are longer than 28 days. There's also a lot of good evidence for its use in PMS, and breast tenderness before menses and hormonal acne are also traditional indications for using Vitex. In conclusion, we now know that Vitex actually has LH lowering properties rather than it elevating LH. We also know that it stimulates dopamine, which inhibits prolactin. And I would say the information on dose dependency is still very unclear as to what is a low dose, what is a high dose, and what kind of dose would actually increase prolactin. Very interested to understand what these monks were doing. Maybe they were having a super low dose and it was actually increasing prolactin, or maybe they were eating a ton of it. So that I don't know. So to summarize that, I don't think there is any reason to not use Vitex with PCOS because it raises LH, because we now know that it doesn't do that. There may be other herbs which are better for PCOS, but I would not think that it's contraindicated. If it fits the clinical picture, then I think it's fine to use Vitex with PCOS. And specifically when there is known elevated prolactin, then Vitex is a very specific good choice. Well, that's it. Thank you so much for attending this presentation. If you'd like to find out more about me or my clinical practice, please visit my website at greenspringherbs.com. And if you have any questions relating to what I just shared, I would love it if you would reach out to me. Thank you so much. Take care.